Hi, as Margaret said, my name's Dave Harding. I'm the president of Ask Me Local 1535. It's a local union that among state workers here at the Utah and Preston Street State Office Complex, just a few blocks from here. Myself, I happen to work for the State Health Department. We also have members in other locations around Baltimore City. I'm not going to say a few of the things that I had planned on saying earlier because other people have said them. And I think some different things need to be said. First of all, I'd like to bring you greetings from Fred Mason. He's the president of the Maryland State DC AFL-CIO. He was originally scheduled to be here tonight, but unfortunately he had other things that came up that made it impossible for him to be here. So in a sense, I'm speaking on his behalf also. I've known Fred for years, and I know personally he's quite committed to having health care for every single man, woman, and child in this country. The world's changing right now. It's changing big time. It's not going in the right direction. We're being told we're going to be asked to give up $700 billion, maybe as much as $1 trillion or more by the time the whole thing's done, in order to bail out big-time gamblers on the stock market, in mortgages, in the bond market, people who have billions of dollars themselves. They don't have a problem getting health care. But a lot of people in this country do. They estimate there are 47 million people in this country today without health care. There are tens of millions more who don't have enough health care. It either doesn't cover all the services they need, or they have to pay too much out of their own pockets to afford it, even though they have health insurance. This can be changed. It's long overdue for it to be changed. Long overdue. It's outrageous that the leaders of this country, years ago, established the idea in the United Nations that health care was a human right, and we don't have it for everybody in this country. More than 60 years later. That's ridiculous. It's intolerable, and we can end it. I don't want anybody in this room to be discouraged because not every seat is filled in here. Big things can start in small ways. We're going to have to make a fight to get health care for everyone in this country. The private health insurance companies, the big prescription drug companies, they are making tens of billions of dollars to come out of our pockets and into their bank accounts for doing nothing in the way of providing health care, but simply because they sit on top of and are in control of the process, the delivery system for health care. We've got to end that. They don't want us to, because they want to keep making those tens of billions of dollars. You can rest assured of that. They want to keep making that. They are willing to have people die in this country in order to go on making that. So we're going to have to make a fight to stop that. And it's going to have to be a big fight. It's going to have to be an uprising. You understand what I'm saying? It's not going to be easy because they don't want to give that up. And so we're going to have an uprising to make them give it back. To end their stranglehold over what we need to live. And we're going to need it more and more. They've been taking health care away from people who had it up until now, for the last few decades in this country, a lot of union members are losing their health care. And we can expect that it's going to get worse, particularly now with what could be the collapse of the economy. In any case, some very, very rough times ahead. So I'm glad to see all of you here. I think it's entirely appropriate that we're meeting in this church where people organized years ago to make a fight against racism, against discrimination, to try to set right some of the wrongs that had gone on in this country for years and years and years, and that are still here today. Because that fight's still not over. But we have made some progress. That's good. And we need to make a lot more. So it's good that we're meeting here in a place where they met earlier to organize, to get organized, to make a fight, to change things. And I hope all of you will become even more active than you are. And I know many of you are. I recognize quite a few of the faces around here, and I'm glad to see you here. And I also see faces that I haven't seen before. And it's good to see you here. Because we're going to have to build a really strong movement to get what we need. So thanks for being here. I hope you show up again. I hope you become even more involved than you are already.